day to you, and welcome to Providence St. Joseph Health. Today we're trying to review some important concepts that affect our everyday lives. That would be infection control. We're going to also bring in a little bit about germs, standard precautions. We'll talk about transmission-based isolation, including the three most commonly transmitted ways that germs are spread: contact, airborne, droplet. We want to touch on hand hygiene and all that that means, talk about glove use, and then talk about bag technique at the end. So hopefully we'll get some information that will be useful for you. First of all, just as an introduction, in a world where laxity is increasingly okay, I think we need to become infection control stalwarts. We need to build infection control into our very core so that it becomes part of our practice. Now, we don't want to be OCD about this, but we have to have a healthy understanding and awareness and respect from this microscopic world that's around us that we cannot see. So being aware is probably one of the first things just to keep in mind. There's a quote that was made: if I had but eyes to see, how very different would I be? You know, you would focus in on, a drinking fountain, the gas pump holder, the doorknob, our purses bringing into our kitchens. If we could see what was on there, we might behave differently. No different from going into patients' homes in home health. So that's kind of the, oh, this could be a problem, background that we need to keep in mind. There's also something called the Targeting Zero campaign for hospital-associated infections, put together by the APIC Society. They started that in 2007 and 2008, and it's basically that all healthcare clinicians aim for targeting zero infections on our watch, zero infections in our agency. And so that's kind of the mindset to have, that zero can be possible. It is not impossible. And if we all do our part, targeting zero becomes achievable, and it might save our family members from having infection. So target zero. Okay, infection control, there we go. So what are standard precautions, actually? Well, if you refer to the sheets that you might have in a packet in front of you that we have designed, these striped sheets, standard precautions is right there. What exactly is standard precautions? Well, it's used for all patients, regardless of their diagnosis or presumed infection status, and it applies to blood, body fluid, secretions, and excretions except sweat, whether or not they contain visible blood, and whenever a person is in contact with non-intact skin and mucous membranes. Those are standard precautions, and they include the blood universal precautions. So standard precautions is actually a larger umbrella than universal, and it is to be implemented always. And because we're assuming that any person could be potentially infected by something that's transmissible. So what does standard precautions entail? Right, the number one area is hand hygiene. So we'll talk about that a little bit later, but that's a big one for preventing infection from being spread. We want to always break the chain in the infection transmission, and hand hygiene is one of the first and best ways to break that chain. We want to break that chain. Standard precautions basically has to do with touch, body fluids, and blood. We want to keep in mind to protect ourselves and the things we have. And so that entails PPE. We have personal protective equipment, PPE. The first one you think of, gloves. So it's helpful to have a good understanding of when you should apply gloves and then how to remove them. And we'll talk about that down here in a little bit. Also, gowns are part of PPE. Gowns should be placed whenever we think that our selves might be contaminated with some kind of a body fluid. Then we would put on a gown as a standard precaution. Also, mouth, nose, and eye protection should be worn whenever you think some kind of a body fluid might be ejected and hit you in the process. And then resuscitation equipment is part of PPE. There's also a part of standard precautions called respiratory hygiene and cough etiquette on the bottom of the page here. In this case, it has to do with instructing the caregivers and observing this ourselves that we cover our nose and mouth when we're coughing with either a tissue or shielding it with our shoulder or elbow, not using our hand, and also doing hand hygiene after we've been in contact with respiratory excretions or secretions. So that's kind of how that cough etiquette works. In the home health environment, we find a lot of folks that like to save their tissues for later use. So part of that, of course, is educating them one time and done, blow your nose, throw the tissue away, perform hand hygiene, that kind of thing. So that's part of the respiratory etiquette that falls under the standard precautions here. In addition to standard precautions, there's also a 2-page area here in our little striped sheets where we talk about the different kinds of transmitted germs. Most germs fall into these 3 categories. They're either contact transmitted germs, airborne transmitted germs, or droplet transmitted germs. And there's a list of the most common germs in each of these pages here for your perusal. Contact precautions, there's 2 kinds. There's direct contact, and that would be what I call the cootie game on the elementary school field, where you touch them and they're it. So anytime somebody directly touches you with their germ, then you get their germ and you have it now. So that would be direct contact. Indirect contact, as you might remember, is when somebody touches an item, leaves, another party comes, touches the item, and obtains it indirectly through the vector and that immobile item. So that would be an indirect contact. The germs that are most common that we encounter that are contact precaution germs would be, what do you think? MRSA or staph, VRE, C. diff is a contact precaution. Any of your multi-resistant drug or multi-drug resistant organisms, we have strep A, we have all staph, including MRSA, herpes zoster, and then conjunctivitis comes to us that way, and then some of our lovely lice, scabies, and that sort of thing. Those would be examples of contact precaution germs. What then do we use to protect ourselves? What PPE do we use for contact precautions? Right here it says always wear gown and gloves. That is default. So always wear gown and gloves when you're dealing with contact precautions. Also, we do not want to take our equipment into the home. So we do not have our bag. Instead, we have a contact precaution starter kit that's available, and it includes multiple gowns. It includes a disposable blood pressure cuff and stethoscope. It includes a mask and a mask with an eye shield. What I recommend when you bring this into the home instead of your bag, that you also make your phone call to order more gowns to be delivered, because there's only enough gowns in here for maybe today and tomorrow, and then the 3rd day the clinicians will still need gowns to protect themselves. So we will bring that into the home. So our PPE for contact, always wear gown and gloves, good, and don't bring your things into the home. Now we will bring our EMR into the home for the contact precaution patients. However, what we're going to do essentially is gown and glove that piece of equipment. So we will gown it, as a matter of speaking, by putting a barrier down, and then we would put our EMR on that barrier, essentially gowning it. So we'll just pretend that this is my EMR, so it's small, and I would put that on my barrier and work there. Now, gloving my EMR, right, always wear gown and gloves, would be essentially doing hand hygiene before I touch it. So that would be, in essence, gloving it. So that way I'm able to bring my EMR in, because I still need my brains with me when I go into the home, but I'm not exposing it to anything in that environment. When I am finished, I do not have the patient sign or use a stylus on it. There is a paper version to record that we were in the home. We use that instead of having them touch our equipment, because contact precautions, right? We don't want their germs on our things. So that would be what we would do for contact precaution patients. Also, as a side note, for C. diff patients only, that Clostridium is not, it does not get destroyed by alcohol at all. So we're going to use soap and water only for hand hygiene there, and we're not going to use any alcohol hand rubs. And equipment needs to be clean on your C. diff patients with a bleach solution, usually a 1 to 10 percentile on that. So that's contact precautions. Airborne precautions is next. Airborne precautions and droplet precautions, they're actually transmitted in the same way, right? So it's phew, and all that kind of airborne directed stuff. However, the difference is airborne germs are light, they're small, they're little helicopters. They actually can float unassisted in the air for up to 16 hours, which is a long time. And if you've got fans going, or either ceiling fans or floor fans, it'll keep them up even longer than 16 hours. So they're very dangerous, airborne germs, because nobody can see them, and they can be ejected into the environment from somebody who's carrying it by their coughing, and then when the person leaves, the stuff's still floating around, and the next party can come in and obtain that germ. Now, this is why it's scary, because it's just forever up in the air. What are the 4 scary airborne germs that the world is aware of? TB, SARS, avian flu, and anthrax, right? So that's scary stuff, right? Because it stays in the air. There are other ones that are airborne that you've heard of. Chickenpox, the adenovirus, and what was the other one there? Measles. So that's why there's always a high alert on those. The first 4 can actually take your life out. Measles is a problem, and also the other 4 are very severe. So airborne precautions. What do you need to do as far as PPE for airborne precautions? That requires an N95 particulate respirator. We're not talking mask here. We're talking an N95 particulate respirator. These need to be fit tested to your own face, because all faces are not the same, and some of these N95s don't fit people correctly. So all of these have to be fit tested before you wear them, but they protect you 95% of the time from the small tiny germs going in through this respirator front. Again, not a mask. Those won't help you. You must use at least an N95 quality particulate respirator, and they have to be fit tested. That is the PPE for airborne germs. Okay? The last one on our list, droplet precaution germs. The most common droplet precaution germs would be your influenza, that's seasonal or pandemic, including Haemophilus influenza type B. It would be your meningitis that comes from influenza B or Neisseria meningitis, your meningococcal diseases, various kinds. Strep also can be droplet precautions. So if somebody has strep throat, that would be, you'd need to wear the right PPE for that. And German measles as some examples of some. What you need to use for PPE on this mask for protection. So what you instruct the patient to do, or what you do, is if you notice the patient is sneezing and coughing when you get to the home during flu season, you would place this over you, and you would be protected from droplet. The great thing about droplet over airborne is it's a big fat germ. and it hangs on to the drops that are aerosolized when people cough, and it goes straight down with gravity to the ground. Yes. So none of this floating in the air for hours at a time, right? So it just falls on the ground. The key is staying 3 to 6 feet away from these people. So if you're at the grocery store during flu season and the lady behind you in line is just what you simply do is ask her to go in front of you, step behind her, or get away, and you won't get the flu from her. So it's that 3 to 6 foot rule that keeps you away, because the droplets will fall down before they get to you. Some young people can cough 6 feet, so that's why it's expanded to 6 feet. It used to be a 3 foot rule, so be careful on that during flu season. For us caregivers, we're getting close, we're doing blood pressures, so what would you need to have on to keep yourself from getting sick? It would be the mask. Also encourage patients to wear the mask if they go outside of the home to doctor's appointments to protect the people around them from their droplet illness. What else? The other thing is, if you're around people with droplet germs and they tend to cough on things, and you touch those things, then reach into your pocket to get some M&Ms to pop them into your mouth, you're going to get that droplet precaution germ. So the hand hygiene comes in here. Always do hand hygiene before you reach into your pocket to grab those peanuts or those M&Ms or the little chewy gum in flu after you've touched the environment, because people are sneezing, coughing over everything, and that will keep you safe. So a bit of droplet precautions with standard precautions mixed in. Sometimes for droplet precautions, you might also need a mask with eye shield to protect yourself, and some of the things like the contact precautions, some of the germs are like chickenpox can also be contact and airborne together, or contact and droplet. So you want to check that out on the list and make sure you have the proper PPE to keep yourself safe. All right, so that's it for standard precautions and transmission of germs. Let's look at hand hygiene. That is a great way to protect yourself, and we want to look at what exactly hand hygiene is. When do we do it, and how do we do it? So under our policy, we follow the WHO, the World Health Organization, and they have what's called the 5 moments of hand hygiene. And they've designed 5 moments to make it easy for us to remember when to do hand hygiene. Those moments are: 1, before touching a patient. Moment number 1, before touching a patient. Moment number 2, before any clean or aseptic procedure, we'll perform hand hygiene. Moment number 3, after body fluid exposure risk. Number 4, after touching a patient. And number 5, after touching patient surroundings. So those are the 5 moments where we want to do our hand hygiene, because we are coming into contact with patients and we're coming from the outside. We don't want to bring the outside to them. And then after we've been with them for a while, we don't want to take them somewhere else. So what we're doing essentially is we're dressing our hands, cleaning them, so we can do the next thing and be appropriately dressed, right? Clean and well for our next assignment, our next technique we're doing, and so forth. So those are the 5 moments. Also, as an addition, before and after glove removal, and before and after we enter our nursing or clinical bag, we want to perform hand hygiene as well. So that's when to do it. Next question, how do we do hand hygiene? You have 2 options. You may use soap and water, or you may use alcohol-based hand rub. And we're going to talk about this a little bit. The soap and water is actually a 40 to 60 second procedure, and that's after you find water. So this could take quite some time. The other problem with hand washing is it strips your hands of essential oils, protective oils, that keep your hands lubricated and supple, which means you can open it up for openings, which makes you at greater risk for having infection come in. So your barrier is broken down if you do a lot of hand washing with soap and water. Alcohol-based hand rub, in contrast, takes only 20 to 30 seconds. And as long as the alcohol is above 62%, it's safe enough to use. It actually kills germs. There's often other emollients in here, like vitamin E, that nourishes your skin at the same time. And as I mentioned, the alcohol actually kills the germs. And it's faster. You don't even need to go find water. So this is actually preferred for hand hygiene. However, there are 4 cases where alcohol cannot be used, and you must use soap and water. Those 4 cases are, your hands are visibly soiled. So there's black stuff, tar, dirt on my hands because I worked in the yard, I changed my tire. That black stuff needs to be mechanically removed by the actions of soap and water, right? That's number 1, must use soap and water. Number 2, you've touched something, body fluids, proteinaceous materials, right? If it's wet and sticky and you touched it, you need to wash it off mechanically, soap and water, all right? Number 3, and this follows from number 2, you've touched your own body fluids. In other words, you went to the bathroom, okay? And number 4, C. diff. C. diff does not get killed with alcohol, so you must use soap and water in order to have proper hand hygiene, all right? So other than those 4 cases, please remember those 4 cases. It will be on the test. Other than those 4 cases, you're free to use alcohol-based hand rub, okay? Now, so that's the difference between hand rub, soap and water and alcohol-based hand rub. Now, how do you wash your hands with soap and water? I know you're gonna laugh, but we have to review this. So you get your soap, and CDC says you have to use liquid soap. We follow WHO. They do allow bar soaps, but in our country we have lots of liquid soap. We give you liquid soap, so use liquid soap. But if you ever happen to be in a foreign country and you don't have liquid soap, the bar soap would be fine. So you're going to get your bar soap, or your liquid soap. You're going to find your water, turn on the water, moisten your hands, apply the soap, and scrub vigorously for at least 15 seconds. Now scrub it, right? 15 seconds. It's a long time. It's not happy birthday either. Happy birthday is 10 seconds, by the way. So come up with your own song, and then you're going to rinse your hands. Once your hands are rinsed, you're going to dry them with not a hand towel from the patient's home, all right? Because we don't know where those hand towels have been. So you've been provided paper towels, so use those. Dry your hands with a paper towel, and then how do you turn off the sink? Very important. Use the paper towel to turn off the sink, right? Because the faucet has been touched by multiple dirty hands, and if you touch the sink again, you've just invalidated the hand hygiene. So turn off with a paper towel and then dispose of that. 40 to 60 seconds, soap and water. Yes? The next one is the alcohol-based hand rub, and again, pick the right alcohol-based hand rub. In home health, the agency provides the hand rub. Don't use super perfumed hand rubs from the local perfumed hand rub store. It can bother patients, so we have our own. Use an amount that's right for your hand. That will be your judgment. If you get too much, it drips, falls on the floor, looks unprofessional, and doesn't work. So if you use too little, you're only doing your palms, and then you're done, and that won't be efficient either. So use enough to get front, in between, back of the hands, and then don't forget the thumb area. And some people like to get the nails done, and when it's dry, after rubbing, you're finished. You are not allowed to wave them dry. You're not allowed to wipe off any excess. It's pretty much rub it until it's all dried, and the drying actually infects your hands. So that's the hand rub. Okay. So when to do hand hygiene? 5 moments. Before and after gloves, before you enter your bag, and how to perform hand hygiene. We're good, right? Next one, gloves. When do you apply gloves? Well, like standard precaution says, anytime you think you might be around any kind of body fluids or exposed to any body fluids, you would put on gloves. Also, for contact precautions, you're always wearing a gown and gloves, being in that environment as well. Once you have your gloves, so that's when to use them. Getting them on, you have to have hand hygiene before you put them on, because you don't want dirty hands going into gloves, right? So it's always hand hygiene. Let your gel dry, otherwise you won't get your gloves on, and then you can apply the gloves. Do I just wear one pair of gloves all day and consider myself fine? No, of course not. So we need to change gloves. When would you change gloves? Right, a new procedure, a different patient, going from clean to dirty, going from dirty to clean. Those are times where you would change gloves. And leaving the area and going somewhere else, you would also stop, remove the gloves at that time, and that would be a change as well. So no wandering the hallway with the same pair of gloves on, right? All right, so I've got to take these off. How do I take them off, right? That's important to do it the right way. What you want to do is start out with your two dirty hands. You want your dirty hand to touch your dirty hand. You don't want to do this with a dirty hand, right? Dirty hand to dirty hand, pull your glove off, make a nice ball so you don't lose it and it falls somewhere. Now, fairly clean, carefully remove that second pair, all right? So that's how you would correctly remove a pair of gloves. And throw it away, and right now, perform hand hygiene. Interesting, vinyl gloves have a 30% permeability rate. 30%. So when you have a vinyl glove, 30% of whatever's on the outside could come through. So that's why when the gloves are removed, we always perform hand hygiene immediately after glove removal. And that way we're set. Hands are clean, right? All right. Great. So now we've got clean hands, we know when to wear gloves, and we have left the bag technique. All right, so what to know about the bag? Well, let me just say this bag has been places, all kinds of places. So if we don't have a built-in bag technique hardwired in ourselves, we run the risk of dragging this thing and spreading germs and pestilence throughout the whole county. We don't want to do that. So there is something called bag technique. It's a big term in home health, and what we want each of us to just make a part of us is, how do we do this? We want this to be hardwired into our practice and so natural that we're always doing the right thing with our bag. Okay? So, to start with, it has to do with when you go into the patient's home. You have your bag over your shoulder. You are aware that it's special, so you don't want to just put it anywhere, right? So you knock at the patient's door, they open the door, you greet the patient, and as you walk in, you're looking for a place to put your bag. So that begs the question, where do you never put the bag? Okay? Never put the bag on the floor. Remember we talked about droplet precautions? Where do germs go? They fall down. So that floor is dirty. We don't know how dirty and don't care to find out. I guess you could do cultures, don't want to go there. Don't want to go there. So even if you put a barrier on the floor, the floor is considered dirty, don't do that. No barrier, no floor. Don't put it on the floor. Where else would you not put a bag? You're right. Bathroom, bedside commode, not good places for the bag. But also on the flip side, you don't want to put the bag in a place where there's food preparation going on. So no, not on the kitchen preparation area, not on the dining table, because again, this bag's been places, and people would be ingesting food from a surface where a bag has been sitting, and we don't want that either. By the way, moms, purses are nasty, like these bags are, so don't put your purse on the counter before you make your kid the peanut butter and jelly sandwich. Bad. Okay, it's also not in the best interest to put it on a patient's bed, because the bed is quite it's been used for a lot of things, and we don't want germs coming from the bed to our bag either. All right, so what we're looking for is a firm, hard surface on which to place our bag. We can use a chair, firm chair. We can use a low-lying table or a clean coffee table, something like that where there's space. It's helpful if you ask the patient, is it okay if I place my bag here before you put it down? If you see that the area is clean and dry, you do not need a barrier placed before you put your bag down. However, if you doubt the integrity of your surface, you might want to get a barrier to put underneath your bag. Now that your bag is settled, we're going to talk about how to set up your bag, right? So most bags come with many compartments. All the compartments except this very front are called clean, right? So these are areas where you must do hand hygiene before you get into the bag. The exception is this front area, and in it we have our hand hygiene equipment, right? Because you don't have to wash your hands before you go in to get the items you need to wash your hands, right? So that's kind of circular, but it totally makes sense. So in here is your baggie of paper towels, and please keep everything in baggies, because the worst thing is to dig around. Here's a paper towel, there's a paper towel. It's very unorganized. So keep your baggie with your paper towels in this front area. You would also find your soap and hand gel in here as well. If you need soap, what are the 4 conditions? Remind yourselves. Did you get it? Right, visibly soiled, proteinaceous, your own, and right, see that. All right, so then you might need the soap. Otherwise, you can perform hand hygiene right now with the hand gel, alcohol-based hand rub. And I suggest, if you're using the hand rub, that you gel and tell your patient what you're doing. If you explain to them, I'm cleaning my hands right now before we get started, so I want to do your assessment and see how you're doing, gel and tell. Otherwise, they might not know you've cleaned your hands because they didn't hear the soap and water and the sink running. So make sure you gel and tell. Now that your hands are clean, you now can open your bag and get into what you need. So in the middle, we have our multi-patient use items. This is the big heavy area where we have our stethoscope and blood pressure cuff. We have our barriers here. I'm going to get one out. And I'm going to put my blood pressure cuff and stethoscope on it. I'm also going to get out my blood pressure barrier. We need to use that every time we take a blood pressure. And I am going to get out my thermometer, which is issued by our company, or it's the Next Temps. In this case, it's Next Temps. And we use only the equipment issued by the company. And I'll need that. Also, in my front area, I have my alcohol pads. I'm going to need 1 alcohol pad to clean my stethoscope before use, and 1 to clean it after use. So I'll have at least 2 that I'll need. And I know that I'm going to be doing something that requires glove use. For example, if I'm an RN, or an LVN, I'll need to do some wound care. So I'm going to take out some gloves at this time as well. Okay. So in this multi-patient use items, we've got, those barriers and things. I put in here some my gloves, my alcohol. I've got some suture removal tray for the wound care scissors. I have Q-tips and measurements as a wound nurse here, maybe some lab tubes, but not a whole lot of equipment in my bag. I want to keep this kind of light so that I don't get shoulder issues and have to see physical therapy to have me fixed, because my bag's so heavy I get crooked. But what I need in here, and then the rest is in my card box that I can go and retrieve for wound care needs that I might have. In this section, I like to have our infection control kits. These, you must have 2 with you at all times. This is a basic kit. It is 1 gown, 1 mask with eye shield. You need 2 with you each day in case you use one on visit number 2 and visit number 4 under standard precautions. You notice that that patient has something you need to protect yourself. So that's why we're asking that everybody keeps 2 of these slim kits in their side pocket so that they have it ready just in case for standard precaution purposes. Also in this outer pocket, we keep our CPR mask because if it were in the clean section, if the man coded, what do we need to do before we go into our bag? Hand hygiene. So it's a little awkward. Excuse me, sir, I'll be right with you. Let me wash my hands first before I dig out your CPR mask. So that might be an issue, maybe it isn't. We keep it on the outer pocket. You can also put it in your pocket if you're in a home with contact precautions, so you have it with you in case. All right, so now I have my little barrier with my equipment on it. I'm going to go ahead and do my assessment, take the patient's blood pressure, put on the barrier on their arm first, and then I can apply my blood pressure cuff around here, and then take my blood pressure as I normally would. Now on larger patients, we have available a barrier with a strip on it, or you can take one of these barriers, wrap it around their arm, and then place the blood pressure cuff around their larger arm in case this doesn't fit. When you're finished using the barrier, what do you do with the barrier? Exactly, it's a disposable barrier, you must dispose of it. Folding it up and saving it for later, not appropriate. It's disposable, it's thrown away, just like your gloves do. After your blood pressure, and after listening to the patient's lungs, etc., and you're going to listen on their skin, you would then clean your stethoscope with alcohol after use, making sure everything is cleaned appropriately. And then you would place it back into the bag. When you're finished with your visit and you're ready to pack up to leave, you would gather all your things, make sure things are disposed of appropriately, right? The gloves would be trashed now and everything else. The last thing you're going to do is put everything back in your bag. Since you're going back into your clean bag, what must you do before you go back in? Exactly, it's hand hygiene again. So it's going to be a quick hand hygiene, and then you can place your items back in the clean area of your bag, all right? So that's kind of how that works with the bag technique. Now, anytime during your visit, if you should find out that you need something from your bag, say you've been doing wound care and you discover that you need more gloves. You're in the middle of your process. What do you need to go do before you go back into this clean area of your bag? Exactly, hand hygiene. Make sure that it's part of you. When I go back into my bag, I must go in with clean hands. Again, this is a big deal for bag technique, to keep germs out of your bag, to keep this thing from being this. If you could see, how very careful would you be if you saw this thing just moving, because all the germs were in it from poor care, poor technique, right? So always do hand hygiene. We also have zippers on our bag. It is required that this bag is zipped in 4 situations. 1, there are visible pests in the home. You know what that means, right? Yeah, cockroaches everywhere and all that stuff. Zip up the baby so nothing goes in, right? Visible pests, pets in the home. For some reason, animals love to check your bag out. They're nosy, they want to see what's in it. Zip it up. 3, children. If there's little toddlers running around, little kids, they want to be like you and they want to be in your bag. Zip it up. Or 4, if your bag is so full that if it falls over, everything's going to fall out all over, then zip up your bag in between. Otherwise, you're free to zip or not zip, as long as you remember, if you go back in, hand hygiene before you go back in. Okay, yeah, so that's your bag. So I'm ready to go. I'm going to pack up my things. Paper towels go back in. And my soap, hand hygiene. Did we do it? Oh, the bag. How would you clean your bag if you think your bag is dirty? Well, I think the easiest way is to make your own alcohol prep pad. These are too small to clean the bag with. So I recommend buying a little bottle of isopropyl alcohol, get some paper towels, squirt it, wet, clean it every 2 weeks or so, just to make sure the outside is clean. If you think it was contaminated, you also can remove everything, clean that with bleach wipes, and then this bag is actually launderable. You can wash it in the washing machine, no problem. Just don't put it in the dryer. It'll get weird. And so that's one way to keep your bag clean. If it gets beat up, just ask for replacement. Okay. I think in that nutshell, we've looked at that the world's full of germs. We need to protect ourselves, standard precautions. Take those precautions with hand washing, with being exposed to body fluids, put on the gloves or the gown, eye shield with, or a mask with eye shield, cough etiquette, so follow standard precautions. Know which germs are in the patient's home. If they're contact germs, follow contact precautions, which is always wear gown and gloves and don't take your stuff in. Bring in your infection control starter kit instead. Airborne, if it's an airborne germ, know what to do. It's TB. Do you need mask? No, you need an N95 particulate respirator. Do you need a gown and gloves? You need an N95 particulate respirator. If you're going to be doing wound care for a TB patient, you'll need your N95 particulate respirator and whatever you need for wound care. Gloves, if it's gooey, sticky stuff, you'll need a gown, but you don't need gown and gloves for a TB patient alone, right? Droplet precautions, know what the germs are, and know what your PPE is. During flu season, the mask. 3 feet rule, right. Hand hygiene, you know when to do it, 5 moments. You know how to do it, either soap and water or alcohol-based hand rub. And what are the 4 conditions where you must use soap and water? Okay, and then glove use, when to use gloves, how to remove them, and what to do afterwards. Hand hygiene, great. And the bag, make that whole scenario a part of you. Walk into the house, greet your patient, look for a place to put your bag, put it down, open it up, get your hand hygiene going on, then you open it up, put your barrier down, your blood pressure cuff, stethoscope, your alcohol, your gloves, whatever else you might need, your temper dot thing to take their temperature, perform your assessment. If you need to go back into your bag at any time, hand hygiene, open it up, get another barrier out for your wound care, place things out on that barrier when you're ready for your blood pressure barrier first, and that should help. I forgot to mention we do have shoe protectors. Those are used for only 2 conditions. One is a really terribly, honestly, there's feces and stool on the floor from either pets or people, and it's just awfully gross. That's when you protect yourself from obvious awful stuff. The other reason we use shoe protectors are for those homes where the cultures kind of require you to take your shoes off at the front and not wear shoes indoors. We don't want people walking around unshod, so we are offering shoe protectors so that you can pull them over your shoes, show the family that these are clean, is that okay, and go ahead and go with that. Again, I have clean hands, got my shoe protectors, and they'll go in the trash when I'm finished, all right? Okay, that in a nutshell, infection control and bag technique. Thank you for listening, and thank you for doing your part to keep our patients and yourselves infection free. Thank you very much.